Emergency management of head injury. The emergency management of head injury involves a comprehensive approach that includes nursing, assessment and intervention. Here's how it typically unfolds. 1. Assessment. Conduct a rapid but thorough assessment of the patient's airway, breathing, and circulation ABCs. Evaluate the level of consciousness using the Glasgow Coma Scale (GS) to assess eye, verbal, and motor responses. Perform a neurological assessment to identify any focal deficits, such as unequal pupils or weakness on one side of the body. Assess for signs of skull fracture, such as bruising behind the ears, battle sign, or around the eyes, raccoon eyes. Obtain a detailed history, including the mechanism of injury, loss of consciousness, presence of seizures, and any associated symptoms or medical conditions. 2. Intervention. Ensure airway patency and adequate ventilation. Provide supplemental oxygen as needed to maintain oxygenation. Maintain cervical spine immobilization if there is suspicion of spinal injury until cleared by imaging studies. Control bleeding from any scalp lacerations using direct pressure. Monitor vital signs closely, including heart rate, blood pressure, and respiratory rate. Establish intravenous access for fluid resuscitation and medication administration. Administer analgesics or sedatives as ordered to alleviate pain and reduce agitation, while closely monitoring for signs of respiratory depression or hypotension. Implement measures to reduce intracranial pressure (ICP) if indicated, such as elevating the head of the bed, maintaining adequate oxygenation, and avoiding hyperventilation. Monitor for signs of deteriorating neurological status, such as worsening level of consciousness, unequal pupils, or new focal deficits, and notify the healthcare provider promptly. Prepare the patient for diagnostic studies, such as computed tomography (CT scan) or magnetic resonance imaging (MRI), to assess for intracranial injury. Provide emotional support and reassurance to the patient and their family members, addressing any concerns or questions they may have. Collaborate with other members of the healthcare team, including physicians, neurosurgeons, and radiologists, to coordinate care and optimize outcomes. Overall, the emergency management of head injury requires prompt recognition, thorough assessment, and appropriate intervention to minimize further injury and complications. Nurses play a crucial role in providing skilled and compassionate care to patients with head injuries, ensuring their safety and well-being throughout the treatment process.